My name is Jill Elderkin. This is my head, ears, eyes, nose, throat assessment for my health assessment class. This is the room I'm doing my assessment in. Let me turn it around. It's not going to turn around, so I'll just do this. I have no notes anywhere to help me. And my patient is right here. We'll use the initials JE. So we're going to start today by looking at the eyes. Patient has given me subjective report that he is farsighted, so there's hyperopia. He also wears contacts and prescription glasses and alternates between those. The last time he had a doctor's appointment was approximately 9 months ago. Looking at the eyes, I can see the hair distribution in the eyebrows is the same. There's no drooping or ptosis noted. The sclera is white. There's no redness. Patient has denied any itchiness or drainage. No drainage noted upon inspection. Pupils are equal. The outer canthus lines up with the top of each ear. So there is symmetry there. The eyelashes are, again, evenly distributed with hair. No puffiness noted in the lacrimal gland. Is there any tenderness when I touch there?
No.
Okay. Also, if we check the sinuses up here, I don't feel any swelling. Patient isn't saying there's any tenderness. So we're going to go ahead and say his eyes were inspected with the ophthalmoscope and red reflex was noted. So we're going to go ahead and check the eyes for the optic nerve response and ocular motor. So what we'll do here is check for field of vision. So if you can cover one eye and tell me when you see my light.
I can see it. See it. See it.
Okay.
See it.
Okay, and then cover this eye and tell me when you see it.
See it. See it. See it. See it.
Okay. And now you can take your hand down and we're going to check for nystagmus. This is the abducens nerve we're checking for. So just follow my light. And there is no nystagmus noted. What I'm also going to do is check the pupillary response, which I believe is the ocular motor nerve. So we'll check the left eye first. Okay, and pupils are reactive, are equal and reactive to light and accommodation. We're going to go ahead and move down to the nose, which is midline. No drainage or swelling noted. Do you have any nasal congestion?
Occasionally.
Okay, are you taking anything for nasal congestion?
No, I'm not.
Okay. Patient has stated previously in his subjective report that he does have seasonal allergies. Patient given education on how to avoid some of these allergens. No redness noted. Septum appears midline. Again, no drainage. And the olfactory nerve is going to be tested now. If you could cover one nostril, doesn't matter which one, and then just sniff and tell me what you smell.
Like a peppermint or a mint.
Yep, so this is a peppermint oil. All right, now cover the other nostril.
That's lavender.
And that is a lavender oil. So the olfactory nerve has been tested, the optic as well, the ocular motor, and we have tested the trigeminal. We're also going to move on to the trochlear, which acts like a pulley and brings the eyes down to the tip of the nose. So I'm going to ask you to follow this and the eyes do converge in the middle and follow the pen right to the tip of the nose. We're also going to check the trigeminal here, and what you do is you just check with a cotton swab to the cornea, and if they blink, then that's positive for corneal reflex, which he did blink. So we were able to test the trigeminal. Next, we're going to move on to the facial nerve. So if you could scrunch your eyebrows, if you could purse your lips, smile, no teeth, okay, and if you could puff your cheeks out, okay. So that's a positive test for the facial nerve. Everything's working correctly, and there was nothing that was asymmetric noted. Okay, and so then we're going to move on to the vestibulocochlear, which is the nerve related to the ears. And this is a tuning fork. I'm just going to, when you hear the sound stop, say when.
When.
Okay.
When.
Okay. And again.
When.
Much longer on this side.
When.
Did you hear it on the other side?
Yeah, it
Just
had
not
a
as
better
well.
ring on
Okay.
the other side.
All right. So his ears have previously been looked at with the otoscope. The eardrum was a pearly white. There was no drainage or pain noted. In the subjective assessment, the patient has denied any ear infections or trouble hearing. No hard of hearing noted upon interview with patient. So if we just check the mastoid process behind the ear, is there any swelling, or, is there any tenderness behind there?
No.
Okay, no swelling noted. We're also going to look at, the glossopharyngeal and the vagus. So if you can open your mouth and say ah. Okay, the uvula is midline and the soft palate does move up, which tells us that there is no damage to the glossopharyngeal or the vagus nerves. Do you have any trouble with your teeth or gums?
No.
There's no bleeding noted. Let's see, open your mouth. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27. Actually, 28 teeth in there. 28 teeth. If you could stick out your tongue one more time. Okay, and when he does stick out his tongue, it is midline, which checks the hypoglossal nerve. It's also in charge of the swallowing mechanism and chewing. Do you have any difficulty swallowing?
No.
Okay, or chewing?
No.
Okay. You have any history of gum bleeding or anything like
No.
that? No. Okay. So now we're going to go ahead and check the spinal accessory nerve. What I'm going to do is place my hands on both your shoulders, and I want you to push up. Okay, and that is equal on both sides, and I'm going to put my hand right here, and I want you to push your face against it like you're looking to the left. Okay, and same over here. Okay, and then I'm going to have you turn just a little bit, and I'm going to check the thyroid gland and thymus. If you could turn your head to the right a little bit. Okay, no swelling noted, and could you swallow? Okay, and the esophagus and thymus gland, it's all midline when he does swallow. Let's see. I believe that ends our, we didn't inspect the scalp. So as we look at the scalp, there's no dry skin, hair is distributed evenly, no open areas, the skin is clean and clear. Same thing with the face, no areas of redness or rashes. Skin is smooth and clean. Lips are pink and midline and symmetric. Patient has told me in subjective assessment that in extreme heat or coldness he does get a cold sore, which he is treated with Valtrex, which seems to help. And right now there's no open areas on his lips. Let's see. I think that concludes everything. So that is my head, ears, nose, throat, mouth assessment for my health assessment class. Again, this is Jill Elderkin, and I showed you the whole room. I'll go ahead and show it again, just so you see there's nothing in here that could help me. Okay, thank you.